Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to talk about a condition called retinal detachment. Retinal detachment is a condition that affects the back part of the eye. We call it the retina. The retina is a very, very thin nerve fiber layer that covers the back segment of the eye. And it's a very important structure because it processes all the light that comes in through the front of the eye into the back of the eye into an electrical impulse, which will then be sent across the nerve that connects the eye to the brain towards the brain in order for us to be able to see. The retina is a very very thin structure, so it's about 100 to zero point 0.1 to zero point 0.2 millimeters thick, so it's very very thin. And you can think of it a bit like wallpaper, which is attached to the wall. So it's only fixed in position directly surrounding the optic nerve, and it's attached in the periphery. Everywhere else, it's just held in place by suction from blood vessels, which are from on the outside of the eye, as well as the so-called vitreous, which is like a clear jelly, which sits behind the lens and helps push the retina towards the wall of the eye. If you have a retinal detachment, you can have there's two scenarios of what can happen. In one scenario, there might be the retina might be ballooning off the back of the eye, but still being attached in the periphery and around the optic nerve. This is something we commonly see in cats, particularly with high blood pressure. We might see it in dogs or in cats which have got some sort of systemic underlying disease. So that's sort of the more common presentation for these patients. It can also um, develop into a so-called retinal disinsertion where the whole retina literally just falls off from the periphery, and it's either uh, bunched up like a bunch of flowers in the center of the eye, or it could all drop down to the bottom of the eye, like a curtain, and just sit at the bottom of the eye. It depends on which type of retinal attachment we're talking about. So in the case of a so-called bullous retinal detachment, where the retina is ballooning off the back of the eye, we're mostly concerned about things like blood pressure problems, some sort of infectious diseases, in some cases immune diseases, um, and so forth. In case of a so-called retinal disinsertion, where the retina is not ballooning off, but is literally dropping off down to the bottom of the eye, like a curtain or like a veil, is oftentimes a genetic condition that we tend to see in younger patients, such as um, young Shih Tzus, or in some other dog breeds which have had some pre-existing retinal problems. In some patients, particularly patients after cataract surgery, a retinal detachment can happen as a result of the procedure, not directly the procedure itself, but if there's small tears in the back of the eye and the retina, fluid can go underneath that and then can tear the retina off. So that would be another reason to develop a retinal detachment. That again depends on the type of condition that we're talking about. So if it's a so-called retinal disinsertion, we oftentimes see that in young Shih Tzus. If it's a sort of ballooning so-called bullous retinal attachment, it can either be dogs or cats with something systemic going on. So and that can affect any cat or any dog at any time. It depends. If you have a retinal detachment as a result of a cataract procedure, it's usually only in that one eye. If it's a retinal detachment as a result of a genetic problem, it will likely develop in both eyes, but not necessarily at the same time. If it's a bullous or a ballooning retinal detachment due to a underlying cause involving the rest of the body or an autoimmune condition, it often affects both eyes at the same time. For cases of so-called bullous or ballooning retinal detachment, these tend to respond best to systemic medications, so medical treatment. We'll take the example of a cat which has got high blood pressures. As soon as we start treating that blood pressure problem, the retina should also reattach, and in a lot of cases, vision does come back at that point. If it's an autoimmune disease that we tend to see mostly in dogs, if once you put them on medications to help suppress that immune system, again, the retina can reattach and oftentimes some vision will reoccur. In cases of a so-called retinal disinsertion, medication alone is not going to fix it because it's a mechanical problem. It's a mechanical condition. The retina is torn off from where it's supposed to be and is now lying flat on the bottom of the eye. And this is something that medication will not treat or will not fix. So these patients either remain blind or they have to undergo a procedure called retinal reattachment surgery, which is quite an invasive procedure, quite an involved procedure as well. And vision doesn't always come back, even after the retina has been successfully reattached. If a retina is detached and no treatment is performed, the eye will remain blind. In the case of a retinal disinsertion, which is the the mechanical type of retinal detachment, they're just going to remain blind. If you have a cat which has high blood pressure and is blind from the retinal detachment, apart from remaining blind, they will probably also go on to develop other problems. And those other problems may be more severe than the eye problem. Same goes for immune conditions or infections or inflammations which can cause retinal detachment. It's oftentimes not the eye problem itself which is going to cause problems, but it may be the underlying cause which has a knock-on effect on other parts of the body as well, which can cause more problems. So it's not ideal to ignore these types of conditions because they may have an impact on the general health. So hopefully you found this video useful. If there are any questions or any comments, please feel free to drop a comment below. Thank you very much.